Well, thank you. And also thank you to our speakers joining virtually. So we have our first question popped up here, and you can also see here. So the question is, what are some challenges of scaling the social prescribing program in your respective countries, and how might Singapore overcome these? So maybe we can start from Australia and then work our way.
So challenges of scaling the social prescribing. Look, I think the key challenge is funding. So, and also short-termism of funding, because if you're looking at outcomes, as we all know, it takes a number of years to get to an outcomes versus process measures. So it's really thinking about what are the short-term, medium and longer-term measures that we need to be looking at, and how can we keep funders on the path? And particularly, I think if we're looking at sustainable models, it's government funding. So I think that would be my key take. And I think the other thing too, that health, as we know, is a highly regulated business, but it's also a relational piece, and relationships are about trust. And what we can't have is a situation where somebody trains for a role and then the funding runs out and they no longer have a role. And so I think we really need to think about the long-termism of sort of these relational roles, working with members of the public, particularly if public trust is not always, you know, as it may be, should be for different reasons, because trust, as we all know, is not particularly easy to gain and very easy to lose. And particularly if we've got situations of people who are vulnerable and need support, we need to make sure that there is trust in those structures are going to be long-standing. So I think it's beholden on us to make sure that we generate robust data. And I think that's by working together to provide that data, just as we would if it was, I don't know, pharmaceutical benefits or medical schedules, etc. But also to be mindful about the long-term nature of what we're trying to do, and to work with funders and governments to develop a co-create, collaborate model, because we're all trying to do the same thing here. We just come from different perspectives. But there you go, I'd say funding.
Okay, so I in part covered the topic in my the last slide. Yeah, but I definitely agree that the financing is very important. Yeah, but there are several ways for financing, and some financing thing is quite dangerous because that can medicalize too much the system and involving the like a welfare specialist into medical sectors too much. Then that can deprive those skills of what they really have to do or what they really want. So that I think I recommend the Japanese government to not be in a hurry too much. So you may need to prove the concept very carefully that can suitable for Japanese health systems and welfare systems, and seek for the better integration ways about two sectors or something like that. There are so many the things we have to consider, but another thing is to education for specialists, especially for the medical practitioners. And one good news for Japan is that now there is a core curriculum for medical school students. That was the mandatory list of providing the education for the medical school students. And that now included the social determinants of health in the list. So that is good news. So education is another very important things. And also the Japan Cardiovascular Disease Association, which is a huge association in the Japanese health sectors, medical sectors, they are now preparing for making a guideline for the clinical practices involving social diversity, including the diversity in social determinants of health. So we can involve, it might be possible social prescribing can into that kind of guideline. So making partnerships with many stakeholders, including those academic sectors and practitioners, is very important.
Thank you, Prof. I always feel that social prescribing is probably much easier in Japan than in Singapore, because society-wise, I think Asian Singapore's are a little bit more reserved. Right? We don't really like to engage socially, but when you go overseas, you find that some of the communities are social by nature. So social prescribing could be much easier. So this is an exam question for me because it says Singapore there, right? So I got the answer. So I suppose the why it's important. I think for why the why of social prescribing for Singapore, for most providers are we are very clear why we need to do social prescribing. But I think sometimes we need to explain the why to the patient, because the health-seeking behavior of patients need to change, and it's quite difficult to change health-seeking behavior. Because most patients, when they come to see a provider, they are looking for a cure. So they are looking at themselves as a disease. They are not looking at themselves as a health. So sometimes when you talk, when you prescribe anything other than a pill, a medication, or a syrup, the patient do not understand. So we need to overcome that. That's one. So that's a lot of work for us to do already. I think the how is also very important. When we talk to some of the providers outside of our institution, with our private practitioners and our GPs, they are a little bit concerned as to what is social prescribing. So sometimes we need to really sit them down and then really have a conversation with them, and of course giving them some of the tools and guides to do it. That's why this Saturday we have a workshop for our GP colleagues. So that's the biggest, one of the biggest, because the biggest prescriber of social prescribing will be them, because they are going to be the backbone of our Healthier SG, which is in primary care, right? But the how for the patient is also important, because again, the patient mindset, patient behavior, we have to change that over time. And I suppose the other key question is then financing, which as I've alluded to earlier, the finances also need to go to the community, because a lot of times they are unable to do certain things beyond what they are required to do or perform in the community. And most of them have the same challenges as healthcare providers, because they are also looking after a sicker and sicker community. So sometimes when we want them to move into health, they do need some support from us.
Thank you. Can I invite now our speakers joining us virtually? Can we maybe start with Dr. Robinson, then moving to Cambodia, our two professors, then lastly hear from Professor Tan. Dr. Robinson?
Can you hear me? Can you hear me okay?
Hear you.
Yes. Yes, no, I would agree on the issue of funding is clearly important. And it was interesting, Professor Kondo in Japan mentioned that they presented to the Parliament, and we did the same in Ireland, and that's how we got it written into policy. So before that, funding was piecemeal, it was short-term, as Siân said, and people were very much in temporary jobs, insecure roles. But once it became part of policy, then we were able to scale it up, and we were able to employ people countrywide. The issue then, of course, about education. Our general practitioners love the idea of social prescribing. When you describe it to them, they love it. But there is the issue of trust, as Siân mentioned. So in terms of our projects, evaluation is key. So generating data, and also trust is key. GPs want feedback from the projects. They want reports, they want to know to whom they're referring, and they want to know about the quality of the programs that they're referring to, because they feel a clinical responsibility. So getting a report back has been very helpful in terms of ensuring the quality and being able to roll it out.
Thank you. Moving on to Dr. Kao and Dr. Sareth.
Yes, do you hear me?
Yes, we can hear you.
Okay, so regarding to the challenge of social prescribing in Cambodia program, in Cambodia, this program is new for us, and it just start to implement in this year, and so the problem is with the also other speaker mentioned regarding to the funding as well. We don't have like the funding from the government. We based on the partner. So this we just apply, and then the problem the link occur here mean that we work with the village health support group it means that they are the volunteer in the village to help us, so they don't have a salary. So sometimes mean that they don't have enough time to work, and sometimes after we train them, they stop to do their work because of the work without payment, and they need to do another work to survive. So it's the challenge that we have in here in Cambodia, but we still hope that we can work more on this, and we think that this is a good way to support regarding to the health based on start from the community, and based on our work here. It means that the villager, they said, oh, they got many benefits from the social living. It means that after the village has support group, the village chief and commune women council, they got a trend from us. They do their work and they support their commune, and the commune they happy. But the problem regarding to the financial as well, and also regarding to as Dr. Sareth mentioned in the recommendation, it means that the link worker they ask some like a small support for their work because they now they work for free. So we don't have like in the long term they can continue their work or not. So this the main challenge in here, and also the knowledge on the social living here is in the new, so it seems like they don't have more knowledge on that. And based on our work, we just try to implement, but like just the small. I mean that in one province that we mentioned, we do implement. I mean that, for example, in one province we have like 9 or 10 or 12 districts, but we just do only 1 or 2 districts, and in one district we not do all the commune or village. So it means that we just like start to pilot this. So the point, I mean that with the finance, yeah. This and Dr. Sareth, you have anything to mention?
So for challenging in apply social prescribing in Cambodia, also about the knowledge of the community related to this program, because they don't understand what is social prescribing. And then we also, you know, like we have only small amount of people try to provide training to the community. So like we reach only a small number, and then other community, they don't understand about this, and it's hard for them to join in our program. And also we also have another challenge about in the community we don't have many services besides like health center or referral hospital, but other services we don't have. So in case the link worker or health support group want to help the people, they can go directly to visit their home. You know, besides refer them to health center or referral hospital, they don't know how to refer them. You know, in case they want to support, they can go to kind of like a home visit to visit the patient at their home. Yeah, so it's hard, and like a lot of work for link worker or village health support group. Like they spend a lot of time to do this job. Therefore, like Dr. Dara mentioned, they request some budget to support for their work. So, thank you.
Thank you. Dr. Tan?
Hi, yes. I think the barriers are plenty, but we actually can't, to us at the moment, it's more or less a non-starter, because the doctors don't see it as, the doctors don't see it as their role to actually do social prescribing. And people tend to work in silos. So I think somebody else has two speakers on, so it's feedback. Yeah, can you hear me?
Yes, we can hear you.
Yeah, sorry, yeah. So doctors tend to work in silos, and so they are not aware of the social prescribing as an intervention, and neither do they see it as a role. And I think a lot of education is needed in order to identify social determinants of health among doctors, and for them to see it as their role to do social prescribing. So we are quite behind when it comes to these aspects, and there's still a lot more work that needs to be done.
Thank you so much. Next question is actually our most popular question. We have 17 votes. It is to Professor Kondo. What is the motivation? Motivation could be one of these key success factors of social prescribing. How do you motivate seniors who live alone to attend the social gathering places? But I'd like to ask this question to all of our speakers, and please, I'm going to add an extra challenge because we're pressed for time. So please answer in one word. So one hint here in the comment is making it fun. So if it's fun, then just say fun. So yes, starting with Professor Kondo.
That's what I mean.
Yes, so we're all going to answer.
Yeah, so it was very interesting because, they are not going to the places for, improving their health, but so to have some fun or getting connected with local other people. So that's the part that we need to misunderstand what they want. Specialists are more likely to think like what they need and do something what they need, but we should first provide what they want. And in many cases, their motivation is to have some connections or the places for contribute to the society or communities, or like have some fun. Yeah. So that kind of entertaining, it's very important, I think.
Okay, so that's a bad example of one word answer. And then Dr. Wong, sorry, we're going to go this way.
Okay, one word, last mile.
Last mile. Okay, then we'll move on to
Belonging.
belonging. Okay, Dr. Robinson, you ready for your one word answer?
Encouragement.
Encouragement. Okay, Dr. Sareth?
Like support.
Support. Okay. And then Dr. Tan?
Purpose.
Purpose. Lastly, Dr. Kao? Sorry, we cannot hear you. Oh, okay. Hopefully he comes back. Okay. And then next question. Apologies again, we are pressed for time, so I'm going to move on to the next question. This is something we haven't really touched on during this social prescribing conference yet. So how can social prescribing be adapted for marginalized populations such as LGBT people or persons with disabilities? What is required to make social prescribing successful for these vulnerable groups? I'm going to start with Dr. Wong.
Communication.
Okay, thank you for making it one word, though I didn't put that challenge there. Okay.
Involving people in the co-creation.
Outreaching.
Outreaching.
Yeah.
Okay. Okay. Anything else? You're okay?
I mean, I also have that yes, but as far as I remember, that the Canadian Family Association for Family Medicine, they have excellent videos to communicate with the marginalized people in clinical settings, and with a very careful words or some tools to communicate those things, which is quite helpful.
Thank you. And yes, you have answered. Thank you for the comment in the pigeonhole. Then moving on to Dr. Robinson.
We have LGBT champions in our hospital, and I run a platinum clinic for older people living with HIV, and we're going to extend our social prescribing to that population. So I think education of providers really, and just to be sensitive, because it's listening is what's important. To, you know, and that's our culture. We're not going to tell you anything. We're going to listen.
Thank you. And then next, moving on to Dr. Sareth.
For me, I think we involve them to join in social prescribing. This they can get support from the program.
Thank you. Dr. Tan?
Engaging them in actually development of the program, or actually getting them to develop and run the program, empowering them is probably the most important thing.
Thank you. And then welcome back, Dr. Kao.
Yes, we involve them, and especially we communicate with them and outreach them. Yeah.
Thank you. So I'm pretty sure we have about 3 minutes left now. So to our speakers, if there's any last comment you'd like to make, and then maybe we can make this like 3 words maximum. You want our audience to walk away with, if they don't remember anything, just remember these 3 words.
We have the power to change the future. And I think that's our opportunity, and it's our mandate. So more than 3 words, but I think the energy in this room, and thank you to Sing Health, I think it's just amazing. We have to take it forward and make it happen.
Let's share ideas.
What matters to you?
All right. Now, Dr. Robinson, your 3 words.
Persistence, evaluation, and listening.
Thank you. Dr. Sareth? Oh, no, we cannot hear you. Could you try again?
Hope and care.
Hope and care. And Dr. Tan?
Something better than nothing.
Something is better than nothing. And lastly, Dr. Kao?
Promote social well-being for well-being.
Thank you so much. So this brings us to the end of our session. Thank you, everybody, for your questions and your active attention.